My name is Vuyelwa Baba. I'm an obstetrician-gynecologist, which means I work in maternity, and I was the lead obstetrician for the COVID team. We were approached as the Obs and Gynae department around end of Jan, beginning of February, by the infection prevention and control team. We had our first case of COVID in April. She was admitted, I think, on the 25th of April, and that was our first case. It was a pregnant lady, and it opened up our eyes to how underprepared we were. We were not unprepared, but we were underprepared. And I say we were underprepared because the renovations had been done very quickly in the hospital to try and to be able to isolate the patients when they do arrive. But in terms of the fear amongst our staff members, when this lady who had been in the hospital for 2 days, her results came back and she was COVID positive. And the panic, I mean, you didn't see people running and screaming, but the panic that you could feel amongst the nursing staff and the interns and other junior doctors who were taking care of the patient. And how everyone was starting to think, was I wearing a mask? Was I wearing gloves when I touched her? When I took blood, did I spend 15 minutes with her or was it more? And it was really scary, and even for me, being the lead, because now I had to manage the patient with her obstetrics problem, but also you had to manage the people around you are working with, because now they're all scared, and they're all scared of getting COVID. And at some point we had to, I remember for that particular patient, we had to stop managing the patient and actually deal and counsel the staff who were working around her. Then there was an issue, do we call the people who were on night duty who had been working with her, or do we wait for them to come back? And that's why I think we were underprepared in dealing with the fear that hit the staff when there was finally a COVID positive patient. And remember, our staff, they go back to their homes. Some have small children. Some have got other medical problems, whether disclosed or undisclosed, that now they have to really think about, how is this going to affect me? But in terms of getting the isolation, getting the medication on board, those things were like standard and it got done. But it was the other things that we were underprepared for. Our peak was in July of the COVID, and that's when our numbers increased. And I must mention that at that time, when we started, we only had 4 isolation beds in labor ward. And then we realized before our peak arrived that it wasn't going to be enough space. Then a new ward was created in Ward 59, and that was a 13-bedded ward. As soon as we started getting patients in there, I think we were halfway filling up the ward, we realized when we hit the peak, this ward is not going to be enough. And initially we thought this is going to be it, and it should be enough. And it wasn't enough, because when we hit the peak, we had to move to a bigger ward, which was a 30-bedded ward. And on the highest peak, we had 22 patients in there. In our peak, we started seeing more staff getting COVID. So when I say staff, I mean doctors and nurses getting COVID. And more doctors and nurses having to take time off for either quarantine because they were contact or having been infected with COVID. The quarantine sites helped a lot, so Nasrec and the one in Midrand, because that's where we could send the staff, because no one wanted to isolate at home because of children, partner. There was still a lot of panic that now you're going to spend 10 or 14 days away from home. And this is something unplanned, because one day you come into work and the next day you're a contact, and the following day you get your results and you're positive. And so there was still a lot of panic. And I mean, to this day, I think we were not ready for the amount of of managing the amount of fear that came from our staff members. I've learned in the few months that I've been working in COVID, I'm still working in COVID, that there's not enough in our hospital to deal with a pandemic. I've learned that. The people that we look at every day and possibly take them for granted, our cleaners, the people that hand out food, the people who clean outside in the hospital. I don't think we realize how important they are. I didn't realize how important they were until COVID hit us. They work as a team when there's a ward that is infected with COVID, and they then need to clean or decontaminate that particular ward. But when that team is short, you soon see it. There was a time in maternity where I think they had said 6 or 7 of our cleaners were contacts to the supervisor. And it meant that 7 people out of the team were away. And we had an outbreak in our high care where the very sick pregnant mothers are being kept. And we couldn't get our high care to be scrubbed down. The person who hands out the food, I remember we were talking about PPE at one point. And the protocol is clear on the cleaners, it's clear on the porters, it's clear on the nursing and the clinical staff. But it doesn't necessarily talk to the people who hand out food, which is the ward attendant. So what PPE should they be wearing? Are they the same as the cleaner or the same as the nurse? And we joked about it because then we had to go back to the guideline about what these people should actually be wearing when they're handing out the food. I've learned to appreciate my colleagues more. We started off in maternity with a team of only 4 COVID doctors. When we hit the spike, we were not coping with just 4 doctors. So we had to add on more. At one point, we had a team of 8. We've gone back to now a team of 3 because the numbers are manageable. But you get to realize that, so some people were really scared. They didn't want to do anything with COVID, right? So we couldn't recruit them to come and work with COVID. But the ones that did come on board and did work with the COVID, they had their own issues. Small children, other medical problems that they have, the fear, partners with other medical problems. And we learned to appreciate each other because we have different challenges. And we got to be more grateful of when people started covering for each other because one's too tired, one has had contact and needs to quarantine and is scared. And I think we started checking up on each other more when we got to know more about COVID, but also as we got more exposed and there were bigger numbers. We started checking up on each other more, that, are you okay? How's everyone at home? For us, it's not over. And I'm going to keep saying this because it's not. We're still seeing COVID positive patients. There's still going to be lots of pregnant women coming in for our services.